Hey, everybody. Welcome back to the Compod.
Welcome back. It's been a minute.
It has been a minute. Yeah.
It's been more like months.
You know, we like to let the tension build a little bit.
do.
And then we hit them with the good stuff.
We do.
Yeah.
We're like, did you miss us?
Yep.
It's been
us,
a year.
Rebecca. I'm sure people love seeing that notification
Yes.
that they've got that new podcast on their mobile devices.
I hope so.
Yes.
It's always so good to be here with you guys.
I guess I need to enable that.
Yeah, turn that
Yeah.
on.
I
Oh,
know.
for sure.
Yeah,
Yeah,
you
you
gotta
want to
have
know
it
when the
Get that
Compod
little
has a
dopamine
new episode.
notification. Absolutely.
Yeah.
Well, we always come back when there's something important to talk about.
Of course.
And so today we have two of our student doctors. We have Ben and Dylan on the podcast with us. Thanks for joining us, you
Hey,
guys.
welcome, guys.
Yeah, thank you for having us.
Yeah, of course. I'm excited.
Yay! So this topic for the episode focuses on the ICOM Health Fair. So this is something that ICOM has been doing, and it's a huge lift, and it's done by students at our school who want to give back to the community and help out. And so Dylan and Ben are here to chat about that.
Yeah, absolutely. Yeah, thank you for having us on. I'll just introduce myself a
Yeah,
little bit
please.
here. I am a second-year student here at ICOM, and I am the SGA Community Outreach. So for our student government, I am the Community Outreach Chair, and one of my big responsibilities is to put on this health fair with other students in both of the first and second-year classes, and to bring in the community and serve them in a bunch of different ways that we'll talk about here shortly.
And I'm student Dr. Dylan Trama, and I'm part of the vendor committee for the health fair. So we're in charge of getting all these vendors to come out and support our community by providing them resources that they don't know that they have.
Cool.
It's very exciting. And so the health fair is taking place. Remind me, Ben, when is it?
Yeah, so it will be March 29th, 2025. So a little ways out, a little bit here, but and that'll be a midday thing, so 10 a.m. to 2 p.m. Lots more coming out about that, so we'll see it all over the place. But yeah, we're really excited. We're working hard with about 12 students in our various committees to put the health fair together and make it a great event.
Perfect. What is the mission of the health fair, would you say?
Yeah, so the mission of the health fair, I think it's been pretty consistent throughout the last 5 years that it's been put on, but really to provide health services and education to the community of the Treasure Valley. Specifically, we want to be focusing on the underprivileged populations that have limited access to healthcare. We also want to work on providing different resources for education, as well as checkups for individuals, and educate them on how they work through the healthcare system, because it can be really confusing, and we really recognize that. And when you're not right in it, when you're not a physician or part of the healthcare system, it can be confusing on how to manage that. And also when you don't have those resources, when you're not in a financial situation where you're set up without, you don't have a job, or like
Lack of insurance.
Mm-hmm.
Yeah, exactly. It makes it really difficult to go through all the processes to get your PCP, to get these services, and to even understand what you need to be doing on a yearly basis or what you need to be doing for your health. I think there's a lot of misunderstanding out there. So our goal is really to provide that, and provide a area where we can bring in community members, make a free event where they will be able to see students. Students will be able to be there as well, right? And so they will have this ability to educate the community on what they've been learning, educate them on what they're passionate about, but we'll also have different community vendors, as Dylan was saying, to come in and provide resources, and to be PCP. We're going to have a bunch of primary care providers there that then we can follow up with. And so just walking them through all these different stages of what the healthcare system is and how you can have access to these resources, even if it's not super apparent right off the bat, and if you don't have that insurance and that easy route to these things. So that's really our big goal, and it's a pretty broad goal, pretty broad mission, but we're hoping that we can bring in as many community members as we can and provide some good services.
Yeah, it sounds like it's going to be, the event itself will be a bridge to help community members access some healthcare resources that are available for people in need. I think an important fact that maybe our listeners or maybe even many of us sitting in this room don't realize is that 33 out of Idaho's 34 counties are considered health profession shortage areas or HPSAs. So we not only have a chronic need to attract more physicians to the state, but even the providers that we have currently aren't enough to, to serve the population that the state houses. So very important work that you're doing.
Yeah, absolutely.
And do you want to talk about some of the vendors who will be coming, Dylan?
Yeah, of course. So we have a derm bus that is coming to do skin checks. So
Is that Dr. Portella?
Dr.
Nice.
Portella, yeah.
That's
So
exciting.
They'll be coming to provide skin checks for patients that need them. We also are looking at getting a dentist involved to do some checkups for patients.
Is that new this year?
That would be new if
think
they got it.
is.
Yeah.
I think so. Yeah.
So we're really trying to advocate for that one.
That's great.
And then we're getting a nutritionist to come in because, budgeting in this world is kind of difficult at times. So providing our patients with the monetary education on what specific fruits and veggies that they're able to obtain.
How to stretch your dollar at the
yeah.
grocery store.
Yeah, of course. And then some insurance that we were talking about earlier about Medicare expertise. And then we have a Genesis clinic that's in Idaho, and they specifically are targeting low-income healthcare support. So we're going to bring them to ICOM so that when they do leave our health fair, that they do have somewhere else to go as well. And then Full Circle Health, trying to get primary care physicians from there. And then hopefully some mental health resources that we're trying to work on. ISU next door, they're providing a clinic for us, including some primary care physicians, some pharmacy providers, and maybe some dentistry from them. And then some free eye exams. Those are super important and, kind of out of the way sometimes for patients that have 20/20 vision. And then providing a food pantry. We're trying to work with Idaho Food Bank. So hopefully getting some resources out for the community. And then we're trying to get in contact with YMCA at this time and seeing what they can provide for us. And some pediatric primary care providers. And then, Ben, do you want to talk about the Idaho Health and Welfare and the Immunization Coalition real quick?
Yeah, absolutely. There's two new things that we're really excited about this year that we had our awesome group of students reach out and find these groups. So the Idaho Health and Welfare Administration and their whole team are going to be coming and helping us with more public health kind of things. So we think a lot about our own personal health and, about seeing our PCP and getting our blood tests and all that, but it's also our environmental health is really important. So they're going to be coming in and they're going to be doing lead testing. And they're also going to be they're going to be providing home radon kits. And for those people that aren't familiar with radon, it is one of the top causes of lung cancer. So, and it's just found straight out of the earth. And so you might have it in your basement and you don't know about it, but it's something that we want to educate people on and be able to fix if we can.
That's very exciting. It sounds like there's a lot of interprofessional collaboration that's needed to lift this event off the ground. What have you learned in preparing for this event that you may not have realized going into it as a student doctor?
It's just a small event.
Yeah.
Yeah, it's definitely bigger than I knew it was big, but it's bigger. It's something I was really passionate about when I first heard about it coming here, and something that really drew me to this position and running for it. I guess I knew it was going to be a challenge to get all the students together, but everybody's been stepping up, and I've learned that people are really passionate about getting out there and doing something extracurricular, working with their community. Because when it comes down to it, that's why we're all here. We do get caught up in our schools and doing all our studies, and that's great as well. But we're here to serve our community, and that's something that's really been apparent to me. Is this is our chance to serve the community, and it's really fulfilling to me and to all the other students that we get to go out there and do that. So something I've learned that although although it's really a lot of work, and it's a lot to add on to your schooling, it's going to be absolutely worth it, as long as we can provide some services to community members, and I know we will. So, yeah, what about you, Dylan?
I send so many emails. Yeah, that was like, I was like, I didn't know what I was getting myself into, emailing so many vendors, but also super fruitful from, getting them to say, yes, I want to come to ICOM and provide this support for the local communities. And like Ben was saying, that is like the main drive for this is like to help our community. And when you are a student, like we do a lot of volunteering, but to lead this big event is like a whole different beast. So I only have one section of it. Ben's overseeing it all. So there's a lot of people that go into this event, and a lot of community members hopefully will benefit from all the hard work.
So you both serve in various leadership capacities outside of the health fair event as well. Dylan on SOMA and Ben on SGA. What motivated you to want to take on a leadership position while going through medical school, which is challenging enough, and then you add this extra added set of responsibilities? Are you crazy?
Probably. Yeah.
just a little, yeah.
A bit crazy. Yeah, I've definitely been called by a few people. But no, I think we really enjoy it. I think, the studies are great. And like I was saying before, we're learning a lot in school. But what it's all about is to be out there in the community, be out there and making a difference, being able to pave your own road. And I found that being in these leadership positions and allowing us to put together community events, put together student events to bring everybody around what we're actually here for. I think that's what really has drove me and made me want to come back and do more and more. I might get it in over my head sometimes, but it's all in the good fun of it. I've been really enjoying having these opportunities to really see. We also put on a lot of events just for the students too, and to do things that you would actually think a physician does. Physicians first, they have to train and read a lot of books, but to actually go and do, like we did a casting clinic and doing all these like suture clinics, those are super fun, and everybody likes to come in. That makes you remember, oh, this is why I want to be a doctor. These are the things that I'm going to be able to do. These are the skills that I can bring to my community and actually make a difference. And so I think it's really important to be able to remind people of that and keep everybody going.
Yeah, we are a little crazy for doing so much. But yeah, I think joining as many leadership positions as possible just gives you a better avenue for your professional development. Also trying to get your feet into those shoes of being a physician. Studying doesn't do that all the way, right? That's just the knowledge. It's more so how you interact with your patients and being able to have a one-on-one conversation without feeling like you're talking at them. It's talking with them. And so I joined SOMA for the advocacy part of it to represent osteopathic medical physicians to make sure that we're doing the best we can to support all of our students here, as well on the national level. So osteopathic physicians that are also are being heard. So we're bringing change as much as we can, and I think you can't do that unless you're in a leadership position to advocate for those changes, whether it be in an advocacy role or not.
Absolutely. How do you balance the responsibility of being in a leadership position while also, not compromising your academic performance and study time? Is there a balance that you have to strike?
I think balance is always such a interesting, a loaded question.
Yeah,
honestly.
right.
It's kind of hard to balance anything in med school,
Mm-hmm.
but just, I guess, going back to being passionate, I think that the passion is what drives all of your motivations, at least for me. I was passionate about wanting to come and learn medicine, and so that, when we all get burnt out and tired, but that motivates me. I'm passionate about putting on this event for the health fair, and from other leadership positions, I'm passionate about advocating for the student body in SGA. And I think it's hard to balance sometimes, but just being able to ride with that, the motivation from being passionate about these things, I think that just kind of keeps you on. You just one more thing at a time. It piles on, it gets stressful, but then this is why I'm doing it, and taking a step back, taking a deep breath. This is why I'm doing it, and I wanted to do this. This is why I ran for this position. So I don't know if it's a really answer your question about the balancing. I think it's always constantly something's going, and it's a little bit of chaos here, but I don't know. I personally like the chaos, and I think that a lot of us kind of live off of that.
Yeah, and that's why you're in the leadership position you're in right now. But yeah.
The adrenaline.
No, as a med student, I feel like sometimes it is easier to have so many things on your plate, so you can't let off the gas and you just keep going. But like Ben said, that leads to burnout, so you have to take your foot off at some point. So we just had a break for Thanksgiving, so I went home, and that was a great reset. I mean, we still have another 2 weeks of school, but I didn't study for like 3 days, and it felt amazing.
That's so good.
So, you can make the sacrifices if you want.
No, you have one more week of classes, right?
Oh, 1 week of class.
week.
no,
Yes,
one
and then
weekend.
week of exams.
Oh,
I know this calendar year is a little
Oh.
different than prior years, but
Yeah.
yeah,
How fun.
Crazy.
That's crazy.
So-
I know.
We're moving
It
fast.
flies by, even though it feels on a daily basis that it doesn't.
Yeah.
I think another thing I just wanted to mention that I think is a big part of these leadership positions. There's always so much that you can do and so much that you want to do. And with the limited time that you do have, I think a big thing and the most important thing to understand is to be able to set up the next group for how they can build on what you're doing, because you're never going to fully accomplish everything you want to accomplish. You just don't have the time. But as we transition into the spring semester and we're going to elect new people to fill our roles, we hope to set them up for success in their future too. So I think that's a really important part of our leadership positions too.
Yeah, I would say our class, they really like to get involved with a lot of things. So they're repaving a little bit. So hopefully for the next class, they'll have a very wide road that they can move around in. But yeah, just to finish off with going with the leadership position, this morning I woke up an hour earlier so that we could do this for an hour. So
Well, thanks for
You
sacrificing.
make-
it out.
make the
Oh,
space.
good job.
Yeah. No regrets. Yeah.
So I have a question. You talked about all the vendors that are coming. Can you talk about how our student body will be involved and engaged in the health fair?
Mhm.
I'm so glad you asked.
Yes.
Yeah, absolutely. So we, as Dylan kind of just alluded to, our students are so involved in so many clubs. We have, I don't even know how many clubs.
A lot.
Like over 50 at
It's-
last count.
I
Yeah,
know.
it's a lot, which
is a
is
lot.
awesome.
Yeah.
Everybody is getting really involved, and there's a ton of clubs out there. And so we, at the beginning of our process here, reached out to all the clubs and see which one of them would want to be involved in the community health fair. And excited to announce that we have over 20 clubs that are going to be involved, and doing a bunch of different things. So some examples. We have our American Medical Women's Association, who are going to be providing free feminine care products. They're also going to be helping with the mammogram truck that will be coming in and providing free mammograms. We have our lifestyle medicine group that will be providing nutrition education. And we have our family medicine group that will be helping with the physical exams. So a really neat thing for our students that we get to do is our family medicine and internal medicine student interest groups get to come and work with our faculty to help provide an overview physical exam, more of a physical exam practice. We're not diagnosing anybody or anything, but we're practicing our physical exam skills and providing some education to the patients that are coming in, and then we will have a resource to, if we do see anything, we talk to our clinical faculty about, this is something I saw that maybe they want to look into, and then we refer them to the primary care providers that have come to the health fair to be out there to table and to set up follow-up appointments to actually look into their issues and provide them with a physician to be established with. So that's a really neat thing, and the students have really enjoyed doing that. In addition to that, we are an osteopathic school, and I know Dr. Davis can talk maybe a little bit about this, but we have our student group that is our osteopathic interest group, our osteopathic organization, SAAO, and they are going to be providing OPP or osteopathic treatments to
Demonstrations.
yes, not treatments, demonstrations for the patients. So that'll be a really neat thing to educate about osteopathic medicine and to get some hands-on practice for the students.
I think that portion's really exciting because although we've been around for 7 years, what is a DO? What is OMT is still a question that we get asked often. And I know you've overseen many health fairs. Is it exciting for you when the patients come in and they seem like to be really interested in the demos that they're receiving?
Yeah, I think that that does seem to be a popular attraction, so to speak. I think a lot of it is curiosity and trying to gain an understanding of what OMT is. So I think you have some that come to the health fair having no idea at all what osteopathic medicine is or what osteopathic manipulative treatment is. And then I think you have another group of people that are somehow attached to the school. So often it's students' parents, it's a significant other, it's other people that want to come in, and learn more and experience more of that as well. So, that's a question our students will be asked their entire career. So,
and that's important too, I think, when they're doing demos to work on different body types, right? Because when they're in your lab, they're in their groups, right? Like their pods.
We've actually mixed it up a little bit this year. Yeah. So historically, our students have been with the same group of 8 or 10 for the entire school year. So, and then within that group, we definitely encourage them working with others. But this past year, we've done a mix-up every single lab.
Oh, that's exciting.
Yep, just to encourage more of that, interacting with different students, different, not that our students generally have ailments, but we all have different musculoskeletal conditions.
Right, we're all
different.
different.
We're all different. But again, yes, then for the most part, our students are fairly healthy and, don't have a lot of these chronic issues yet.
Mm-hmm.
So one opportunity at the health fair is even in their physical exam skills, right, as they start to see, people and patients who have real physical exam I don't want to say real, but they have different physical exam findings than what they're used to seeing among their peers.
Yeah, that's exciting when you get that hands-on opportunity to cosplay as a real doctor.
Absolutely.
Yeah, we had actually our standardized patients were in the lab. What was it, like 2 weeks ago, maybe?
I love RSPs.
I know, they're so
fun.
great. And one just stopped and he was like, "Wait, I want to show them this." It really didn't have anything to do with what we were doing, but it was he had an abnormal physical exam finding, and it was great to kind of be able to explain to the students like, well, this is what it is because it's not portrayed. So our standardized patients portray clinical vignettes. If they don't have a physical exam finding, they hand the student the card. So when we have a standardized patient that's there and is like, "Hey, I want to show the students this," so that they see this and recognize it, that's kind of fun too.
Yeah.
And that's what happens on rotations, right? Your attending will be like, "Oh, hey, come in here and look at this. This is we've got bullous laryngitis in the ear." So and then you kind of start seeing these things. But that's our SPs in the middle of our musculoskeletal OPP lab. So
That's so funny. I love it.
They're great.
Anything else about the health fair that you guys want to add? We'll put a link in our episode description so that people can get like the RSVP information, and I'm sure they'll have to sign up for an appointment with St. Alphonsus, the mammography. Am I saying that right? Bus?
Mm-hmm.
Yes.
Perfect. And then Dr. Portella's bus too, I'm assuming.
Yes, we will get all that information, and we appreciate you linking that. Yeah, one other thing that I just wanted to mention, I thought it was a great point that Dr. Davis said. This is our chance to educate people about what a DO is and what osteopathic medicine is. And so I think having the OPP, OMT demonstrations also gives us an opportunity to answer some questions from the community. And I think that's a difficult thing sometimes, definitely for a med student, and you get better and better about it, but answering what is a DO, what makes it different? Like, I've never heard of a DO, tell me about it, and to be passionate about this is what the profession I'm going into, and I want to be passionate about what we can do and what we can provide for you and how we can treat you holistically. And so I think it's a great opportunity at the health fair as well to provide that education and answer some questions and get some practice at answering those questions as students. So really excited for our students to be able to do that and interact with the community in that way.
Yeah. And thank you guys so much for putting this on. I know it's such a big lift and it truly takes a village. So as some of the project managers, thank you for your service.
Yeah, of course.
So we appreciate it. We appreciate you having us on.
Yeah, thank you.
Yeah, thank you.
Awesome. Thanks, guys.
Great,
We'll
thanks.
see you later.
Okay, bye.
Bye.